Good evening, my name is Trinity Slade, and today we'll be discussing the effects of neurofeedback and family therapy on drug addiction. So first, I will define what drug addiction is and how it is caused. So drug addiction is defined as a chronically relapsing disorder that's characterized by a compulsion to seek or take a drug. This often involves loss of control and limiting intake of the drug, and emergence of negative emotional state when the drug is not accessible. So this involves decreased mood when the person who is suffering from the drug addiction cannot access the drug. And there are several potential causes for addiction, including genetic predisposition, so if a parent or family member has been exposed to this drug addiction, environmental factors such as peer groups, family beliefs, or neurological predispositions or vulnerabilities. And among these vulnerabilities can include affected dopamine receptors, the nucleus accumbens, and the hippocampus. So opiates in particular are among the most addictive drug type in the United States. This is due to their strength and how they bind with receptors in the brain. The nucleus accumbens is known as the pleasure center of the brain because it processes dopamine, and certain drugs can flood this system with the dopamine, and this increases addiction probability. With this, the nucleus accumbens and the hippocampus may be two very important regions to look at when studying and treating drug addiction. So next I'll talk about why this is an important matter to focus on. According to the National Survey on Drug Use and Health, a total of 19.7 million adult Americans, battled a substance use disorder in 2017. Within this number of Americans, about 5.1 million young adults, which are quantified as people between the ages of 18 and 25, battled a substance use disorder. And this equates to 14.8% of the population, which equates to about 1 in 7 people. So this is a very common disorder, which is why it is important to research and study treatments for it. So opiate overdose is among the leading causes of death in the United States. So how can we treat opiate use disorder? Several procedures are currently in place to treat this addiction, and a very common form of treatment is norepinephrine and methadone. However, non-medical approaches to treatment are currently being seeked out and tested. Among these methods are neurofeedback and family therapy. So EEG biofeedback or neurofeedback is a behavioral and neurological self-regulation method of retraining brainwave patterns, and this is done through operant conditioning, which is a learning method based on positive and negative reinforcement. Family therapy is a method that is also used to treat family therapy, and this is done through encouraging a patient to feel comfortable in having a support system, often their family or their close friends, and this potentially decreases substance use cravings. So now we'll talk about who is being studied in this study. So in my current study, I will have 20 men and women between the ages of 18 and 55, all who meet the criteria for opiate dependence disorder. They will be selected from an outpatient clinic where they are currently being treated for this disorder. The prospective participants will receive the DSM-IV criteria for this disorder, and after satisfying 4 or more of the symptoms for this opiate dependence disorder, their qualifications will be met and they will be selected for the study. So these subjects will be randomly split into 2 groups, the neurofeedback group and the family therapy group, with 10 men and 10 women in each group. So now we'll go on to how this will be treated. So brain activity will be broadcasted to the patient through a visual exercise in which the patient will engage in an activity where their goal will be to have the screen color change. So the gradient will go in spectrum progression order, so from red to violet, with violet being the ultimate achievement. And these sessions will last 30 minutes once weekly for 1 month. The patients will be put into a room without any distractions and will be instructed to maintain positive coping strategies and mechanisms to achieve this proper color progression. So sensory motor rhythm training will take place in the central brain cortex, and as previously modeled by researchers Degani, Irani, Rustami, and Nadali in 2013, the reinforcement band will be the SMR frequency band, and the suppressed frequency will be delta, theta, and high beta frequency bands. Whenever participants maintain the reinforcement bands above the threshold for 90% of the time, twice continuously, the progression will positively continue, with the ultimate progression being violet. So now we will look at the efficacy of neurofeedback and how it has been previously done. So we can see that for several variables, including attention, hyperactivity, impulsivity, immaturity, depression, along with several other variables, the baseline, which is the blue line, is often a lot higher, which is before neurofeedback, and lower after neurofeedback. So we can see that neurofeedback is a highly effective measure to be used during treatment. So for family therapy, each person in the family therapy group will be asked to create a list of between 2 and 10 family members who they feel comfortable in helping them overcome their drug addiction. These members will be contacted for family therapy sessions, which will last 1 hour and 15 minutes once weekly for 1 month. The psychologist will host a meeting, and the patient will be given the opportunity to explain his perspective of the addiction, his feelings and thoughts towards his family network, and the family will be given the same platform during these sessions. After each session does conclude, the family and the patient will be given a self-report efficacy test describing their views of the session and constructive criticism for the next session. Before each treatment begins and after, now we'll talk about which method works best, whether that is neurofeedback or family therapy. So before each treatment session begins and after the month of treatment ends, each patient will be administered the DSM-IV criteria for opiate dependence disorder, as well as a general health questionnaire, and this is hypothesized that the neurofeedback group will report lower scores than the family therapy group on each measure after treatment is completed, thus indicating higher efficacy in neurofeedback group than in the family therapy group. Previous studies have found that neurofeedback is more effective than family therapy in most patients. Neurofeedback allows for patients to take control of their nucleus accumbens, creating increased control over thoughts, emotion, and focus, thus decreasing the probability for relapse. So future steps for upcoming studies are that future studies should aim to directly measure the efficacy of neurofeedback compared to that of family therapy. There have been several studies measuring the efficacy of neurofeedback and of family therapy, but these two have not been directly compared. Opiate use disorder should also be the main focus of these studies. Ample research has taken place on non-medicative treatments of addiction such as alcohol and cocaine, but there is a gap in research on the protocol of opiate addiction treatment. The results and findings of this study may potentially be a resource for further research of this topic.